Hit Exchange Media Coverage, HIMSS 11.
Can you talk about, with EMR being, the CapEx issue, and it's such a significant investment, maybe the advantages, pros, cons of investing in the infrastructure versus more of a cloud-based solution? Can you talk about that?
There's pros and cons either way. I certainly think that for the physicians, there is a lot of web-based products that they are looking at so that they can be a little bit more flexible in their adoption and in their changes as they move forward. Certainly in the hospitals, it's a little bit less of a web-based solution certainly that they need. But the key to it is access to the data. The key to it is short-term and long-term, as we get into many of the aspects of health reform, is going to be the significance of the analytics to the data and to be able to really understand your true cost of operation.
That's a great perspective. Talk about how you're working with clients to both identify and anticipate needs, emerging issues, so much uncertainty surrounding kind of the next couple, 3 years in healthcare, how you're creating really a scalable solution that's going to be not only applicable today, but moving forward.
Well, McKesson is well positioned for where we're headed, in stage 2 and also with health reform. This significant piece to health reform is looking at it from a patient's point of view and taking care of the total patient. And McKesson has the offerings with Relay Health to be able to provide multiple providers to be able to access data, to be able to get the complete record no matter where you are. It doesn't mean that you have to be connected or you have to be in the same state, the same city, etc. So we have an advantage from that standpoint. We also have played a significant role in the HIEs and being able to influence change and being able to set the standards associated with that. So we really see that that's one of the most important things that we can offer to our customers in getting a jump start in that coordination of care across settings of care again, so that they can look at the complete record.
It's great. Talk about that, the HIE and your role, McKesson's role in helping facilitate that. I'd love to get a little bit more insight on that.
McKesson for years has been in the business of providing an exchange of information. We got into it early in the financial exchange of information and processing claims, and now we're significant in the clinical side of it. So that component of exchange of information is so critically important in where we're headed. Beyond the standards, the particular standards of how exchange to exchange can be able to pass that data, certainly is a huge topic today, and that's where we're headed. But McKesson has had a large footprint in results distribution, in the patient health record, in just being able to communicate and make sure that information is exchanged on an ongoing basis.
Catch the premiere issue of Hit Exchange magazine or visit hitexchangemedia.com for more healthcare technology news and information.